Hi everyone, my name is Vikram Bakchi. I'm a second year medical student here at Michigan Medical School. I'm also a member of the MSTP program here. I think what's special about Michigan MSTP is that the curriculum for both the medical and the graduate schools is really conducive in developing a physician scientist, someone who has an integrated interest in both medicine and research. And so that's really kind of built into the curriculum. So in your first 2 years here in the program, you're on the clinical side of things. First you're learning about anatomy, physiology, and during second year, you kind of get to apply that in a practical setting in clinic and kind of practice the various skills that are specific to being a physician. Physical exam history taking, patient-centered communication, patient care, and clinical reasoning. And then ideally at the end of these first 2 years, you've kind of narrowed down your medical interest to 1 to 2 specialties. This isn't at all required, but it's really helpful because it can really inform your research interests. So for example, one of my friends here in the program, he was a few years older than me. He came in with an interest in neuroscience. And then during his second year, he completed his internal medicine rotation. And during that experience, he got to have 1 month where he worked on infectious disease, and he loved it. He kind of came out of that experience thinking that perhaps his interests had changed from neuroscience to infectious disease. And so because of the flexibility afforded by the Michigan MSTP curriculum, he was able to pretty easily transition those research interests, set up lab rotations, and ideally just try to make sure that his interests are coinciding and better aligning with his clinical ones.